Member for Indi.
Thank you, Madam Speaker. On the eve of closing the gap, I am proud tonight to acknowledge the traditional owners of the land and pay my respects to the elders past and present, and particularly to the traditional owners and custodians of the country within the electorate I serve and represent, that of Indi. Madam Speaker, on my election in 2013, I committed to 3 tasks relevant to Aboriginal and Torres Strait Islander people in my electorate, and tonight I'd like to report on progress made to fulfil those commitments. Firstly, I committed to form an advisory group to seek the advice of Aboriginal and Torres Strait Islander people from Indi's communities concerning, amongst others, the issue of health, education and employment. And tonight I report that I have met with representatives of the Bangarang community, the Tangarong Clans Aboriginal Corporation, members of the Diriwara Local Indigenous Network, members of the Gadabar Local Indigenous Network, staff and representatives of the Mungabarina Aboriginal Corporation, including the Kuri First Steps Kindergarten in Wodonga, the Hume Regional Health Lifestyle Workers Tackling Tobacco and Healthy Lifestyle, and liaison staff from the many providers of educational health services to Aboriginal and Torres Strait Islanders right across Indi. And in this work, I'm grateful for the assistance and the advice of Darren Moffat. Darren is the Indigenous Community Development Broker working with the Office of Aboriginal Affairs within the Hume region. And in acknowledging the warm and frank advice I have received from the representatives of those organisations and communities, I also wish to acknowledge Matt Burke, OAM, who in July 2014 completed nearly 4 years of service as the CEO of the Mungabarina Aboriginal Corporation in Wodonga. And amongst the many achievements of the corporation during his service as CEO, the establishment, in partnership with Wodonga-based Wilson Transformers, of a unique and successful Aboriginal youth traineeship, which has successfully skilled and employed 19 young people. And I'm delighted to let this House know that this model is now being copied by other Australian enterprises. And in acknowledging Matt Burke's service, I also welcome to Indi Mr Michael Cutmore, who is following Matt into the CEO role. Secondly, Madam Speaker, I committed to make a public statement at every available opportunity to acknowledge and recognise past mistreatment to the stolen generations. So on the 28th of May 2014, I rose in this House and fulfilled the first part of that commitment, and in doing so, closing in part the gap in the recognition of the grief, suffering and loss which has remained open for a generation of children and their families for so long. And thirdly, Madam Speaker, I committed to acknowledge the traditional owners of the land. Myself and my office are now very proud to acknowledge the traditional owners of country and pay our respect to elders past and present, and we will continue to recognise the significance of and respect due through such acknowledgement. Madam Speaker, in this work I've been advised, assisted and encouraged by many, and tonight I'd particularly like to thank for their friendship, wisdom, advice and for the representation they give to their communities. To Uncle Wally Cooper, to Uncle Freddie Dowling, to Auntie Bernadette Franklin, to Uncle Sandy Atkins, to Uncle Roy Patterson, to Auntie Sylvia and to Auntie Pam Griffin, who in December last year retired after 20 years' work at TAFE. Thank you all very, very much. You've taken a raw recruit, polished her and put her in a place where she can now speak on your behalf. In considering the continual national commitment made by successive governments to closing the gap, tonight I acknowledge the work being done in our local communities, which is where the hand-to-hand and heart-to-heart tasks of closing the gap are undertaken. By those people already mentioned, and by organisations such as North East Health Services in Wangaratta, Benalla Health, Albury Wodonga Health Services, Women's Health Goulburn North East, Gateway Health Services, the many rural primary health providers, La Trobe University, Wodonga TAFE, Goulburn Ovens TAFE, and our many secondary colleges and schools. Well done. And in closing, last year the government announced the Indigenous Advancement Strategy as a means to consolidate and provide a more efficient, effective and consistent...
The honourable member's time has expired. I call the